Why is it that some men walk out of a prostate cancer diagnosis knowing every option available to them, while others, no matter how many appointments they sit through, never once hear about the treatment with the highest cure rate? I'm Dr. Ajay Bhatnagar. I've spent 20 years watching that gap play out in my office. Today, I'll show you exactly how that happens. The one question that tells you if your doctor told you the whole story and what that means for your recovery. When a prostate doctor tells you your options, he's telling you what his office does. The three things he lists are almost always the three things his practice offers. He's not going through every treatment available for your type of cancer. He's telling you what his clinic can do. That's just how the system works. Your regular doctor sends you to a prostate doctor. That prostate doctor tells you what he does. Nobody in that process has to tell you about a treatment he doesn't offer. Prostate cancer has more good treatment options than almost any other cancer. When one of those options get left off the list because the clinic can't make money on it, that's a business decision, not a medical one. The doctor who saw you first has already narrowed your choices, and he probably didn't say so. LDR brachytherapy, the prostate seed implant, has been around for 30 years. For prostate cancer that hasn't spread, the cure rate is above 98%. Most men keep their sexual function after the procedure. The whole thing takes about 45 minutes. You go home the same day. Most men are back to their normal life within a few days. Compare that to surgery. For men over 70, more than 65 out of 100 deal with permanent impotence after surgery. More than 25 out of 100 have long-term bladder leakage. Recovery takes months. External B radiation means coming in every weekday for up to 2 months. For intermediate risk cancer, it usually comes with 6 months of hormones. Those shots cause hot flashes, no sex drive, fatigue, weight gain, and muscle loss. So the seed implant has better side effect numbers for most of the men I see and a cure rate that beats the other options. And yet, most men never hear about it from their first doctor. The reason is money. Clinics stopped offering it when the other treatments that made more money came out. Then doctors stopped training to do this procedure. Now, very few doctors in this country still perform it. Think of it like a restaurant that took 3 dishes off the menu because they were too hard to make. The waiter doesn't tell you the menu changed. He just reads you what's left. Clinics stopped offering brachytherapy when the other treatments like IMRT came into play that were 3 times as much revenue. The outcomes were the same. The question is whether your list is missing something. If this is changing how you see your options, hit subscribe. Every week, I put out straight breakdowns of what the data shows for men going through this decision. No spin, just what I've seen across 15,000 patients. Did your doctor mention brachytherapy, the prostate seed implant, as one of your options? Did he explain why a specific treatment fit your age and your test results? Or did he just recommend what he does for most patients? Did he show you the numbers on sexual function and bladder control side by side for each option? If you asked about brachytherapy, did he give you a medical reason it wasn't right for you? Or did he say his office doesn't do it? Have you talked to a cancer doctor who actually does brachytherapy? If brachytherapy wasn't on your list and your doctor didn't give you a specific medical reason to skip it, your list came from what his clinic offers. Most men I see are in that spot. Early stage cancer, told surgery was the right call or the only call, never shown the side effect numbers, never told a 45-minute same day option existed. They spent weeks comparing two treatments. neither one was the best fit for their case. Once you see what's driving these recommendations, the right move is simple. The decision in front of you is which doctor to see first. That's it. Your treatment will almost always be whatever your doctor does. So, the way to see the full list is to find a doctor whose list includes everything. That means finding someone who does brachytherapy and could walk you through all the options from the same office. After 15,000 patients, here's what I see every time. Men who come to me after one consult have already been pointed towards surgery or external beam with no specific tied to their case. Ricky was 59, a fitness trainer in Atlanta. He was told surgery was his only option and he wouldn't be able to work out for months. Tom was 62 and owned a pool company. He was told surgery only, 3 months off work, which would have put him out of business. Both of them found me on their own, had the seed implant, stayed cancer free, and went back to their lives. Neither one was told the full picture before they found it themselves. When you see that the decision is really about who you talk to, you stop trying to pick between two treatments and start trying to find the right doctor. That's one phone call, not weeks of research. You can't make a real treatment choice inside a conversation that only has two options. Here's what that first move looks like. Most men compare treatments inside their first doctor's office on their first doctor's terms. Asking about brachytherapy by name changes that. A doctor who does it will explain it. A doctor who doesn't will give you a reason, and that reason tells you whether you need a second opinion. When you're no longer picking from a short list, something changes. You're asking whether you've seen the right doctor first. That's a better place to start. At your next appointment, ask this question. The question is LDR brachytherapy, the prostate seed implant, an option for my case? If not, why not? What a good answer sounds like. The doctor walks you through whether it fits your test results, explains the cure rate and side effects compared to the other options, and gives you a real reason either way. What a bad answer sounds like? We don't do that here, or that's old technology with no medical reason tied to your specific case. If you get a bad answer, ask for a referral to a cancer doctor who does brachytherapy. That one visit will show you what the full picture looks like. You came into this thinking the hard part was comparing treatments. The real job is finding a doctor who can show you all of them. That's a more solvable problem than you think, and now you know where to start. There's already a video on this channel that covers why brachytherapy disappeared from most clinics and what the outcome numbers actually show. It's called After 15,000 Patients, I Change What I Recommend for Prostate Cancer. It's linked right here. Watch that one next.